Hi, this is Kyle Wallace with the Wallace Specialty Risk Strategies Dental Practice. And today we're here to talk about health insurance, and not really health insurance. We're here to talk more about the health insurance benefits delivery system. My guest today is Doug Sherman, and he's co-founder of Clearwater Benefits. Now, Doug has had an interesting career. He graduated from the Air Force Academy. He served our country in Vietnam as a jet pilot. And after serving in the military, he entered the business world and has been a lifetime entrepreneur. Doug's worn many hats in his business career, but today he is here to talk about his newest endeavor, which is to really fix the health insurance system, the health insurance benefits delivery system. So Doug, welcome.
Thank you.
All right. Doug, I got involved in health insurance very reluctantly. You know, my passion is malpractice insurance and risk management. And my clients being dentists and dental practices, I've loved serving them in that capacity. And that's led to, over the years, working with them for other property insurance, general liability insurance, and other types of what we call property and casualty insurance, which is the furthest thing from health insurance. I always steered clear of health insurance. I saw it kind of as a no-win proposition. It's expensive, it's confusing, and ultimately, people really don't like it that much. You hear more complaints about it than anything else. So we got involved because our clients became very scared after the ACA became the law of the land. They all of a sudden could not find ways to, our options for insuring themselves and their family, something that had been easy prior to the ACA. So we got involved to try to help them. And, well, I've never been entirely happy with the options we were able to offer, even though I think we have been helpful. So for you, my first question would be, what was your first experience in the business of health insurance and the delivery of benefits to the consumer?
Kyle, having run several companies, I had to buy health insurance for our employees. So that was a little bit of a sticking my toe in the water, but really, that was pre-ACA. After the Affordable Care Act, I was recruited to become the Chief Revenue Officer for a large TPA in Austin. And for the first time, I saw the backstage view of what people were actually experiencing. I could see people who had a $3,500 deductible couldn't afford to use it. They couldn't afford to use their plan. The employer had paid for it, and they couldn't afford to use it because they didn't have the $3,500 and it would usually be more than that. And so it became literally not affordable in the era of the Affordable Care Act. And I just knew that whatever I was going to do for the rest of my life, I wanted to try and fix that problem to make healthcare more affordable and provide better benefits.
The problems you encountered, you've identified one. What other problems did you see with our health insurance system?
Well, we have a number of problems. First of all, employers, especially small businesses like dental practices, face irrational and unexpected rate spikes. I know in California right now, a lot of the small businesses are being quoted a 40% annual increase. Now, that's the highest that I've seen, but I have seen pretty commonly 20%. So over a period of time, it just becomes untenable to be able to afford it. And so the first problem is the lack of affordability of using the insurance. The second problem is the lack of affordability for employers to be able to buy it for their people. And then at the same time, health insurance is one of the key factors for retention and recruiting. So, practices that have insurance where the employer provides some benefit to them is going to be more competitive than a practice that doesn't. So the problems are not affordable for the member, not affordable for the employer, and over time, what we're seeing is a decrease in the quality of the benefits, particularly the networks. The networks are narrowing. Recently, one of our partners had to send a person from Boerne, Texas, all the way to Midland, Texas, a good 6 or 7 hour drive to go to an OBGYN because that was the closest one in network. So the prices are going up for both using the plans and getting them in the first place with the premiums, and the quality of the benefits are going down. Further, there's a huge miss today in mental health. The mental health in many plans is just not covered. Or it's only covered in the worst situations possible where there's hospitalization. So that's a huge issue for our day, just not covered.
Very good. So when did you first think that you might be able to fix some of these problems?
Let's see, it was 2016 when I was with this TPA, and I'd only been there a couple months, but I also had a chance to see industry-wide the fact that most health insurance today is designed to become more and more expensive because of the Affordable Care Act, which we can get into. But it was in 2016 that my son and I were both working in the business, and we just decided whatever we were going to do, we wanted to try and do a 40% decrease in premium, keep the rates level for small businesses, as level as they could be, and then have plans that didn't require any out-of-pocket if they needed to use the health insurance.
So how did you form Clearwater?
So Clearwater went through, years of testing. We started out with various non-insurance options, and they have strengths and they have weaknesses. And then we came to the simple idea that the fully funded insurance companies like the Blue Cross, United, Cigna, and Aetna, they're called fully funded plans, were not the path that would provide affordability. So there's only one other path, and that's what we call a self-funded plan or a level funded plan, and that's what we offer. They're considerably less expensive, and we have designed the benefits to be much broader and much better.
Very good. So you've come this far.
Yeah.
All right. And it's not all the way yet.
Yeah.
But what are you most proudest of at this point?
I think the thing that I am most proud of is that we can save, and we're doing this now with dentists as we're calling on them, we can save the dentist typically $1,000 to $1,200 a month and return $14,000 to $15,000 a year to him or her and their family. That could be used for college, it could be used for their business, it could be used for new equipment, and that they are able to repurpose the dollars that we're going to health insurance and use it for other things.
Thank you, Doug.
You're welcome.
If you guys are looking for more information about the Wallace Specialty Risk Strategies Dental Practice Clearwater Benefits Health Insurance Program, please contact us by email at rdphealth@risk-strategies.com, or you can call us at 972-346-0813.